I believe in El Rio and our purpose and our care of underserved patients. I'm passionate about what we do and the population that we serve.
I'm proud of the high-quality health care that El Rio has provided to our community for many years.
I chose to work at El Rio because I felt that the agency's values reflected my own in regard to patient care.
El Rio administration's proposed cuts in paid time off and increases in patient encounters will not only negatively impact me and my family, but also my patients.
The ultimate cost of implementing this contract will be that our patients and our community will lose trust in El Rio as their doctors and nurses become unable to care for them compassionately and comprehensively under the strain of seeing more patients with fewer resources for lower pay and decreased benefits.
One of El Rio's core values is honor patients, and with making every visit shorter and adding a third more patients to our schedules daily, it will be far more difficult to honor patients and their complex medical and psychosocial needs.
The new proposed number would not allow me to build rapport or meaningful relationship with my patients.
Now with an increased demand in our productivity, it feels like a no-win situation for the therapists and our patients.
The cut in PTO and FTE will force me to stop all of my outreach work.
My fear is that with the cut in PTO and expectation to see more patients and more encounters is going to jeopardize the safety of our patients.
And the proposed cuts to PTO and pay will not allow for providers to have the needed downtime, nor will they feel valued by leadership.
But it's the PTO that has given me some respite. It's given me a chance to have a couple of days off to kind of recuperate and get my energy back.
Where I get to help families thrive. With the loss of PTO, I fear that my family won't thrive.
It makes it hard to be mothers, spouses, family members, and still perform our clinical duties. My child.
We need to know that the work we do matters, and that El Rio is as dedicated to us as we are to our patients and to the community.
El Rio's vision is to become a national model of excellent healthcare, yet the administration's contract proposal values quantity over quality and ensures increased turnover due to staff and provider burnout.
This mode of practice sacrifices our ability to provide quality dental care and treatment.
I feel that this new contract fails to show an understanding of the complexity of the patient population that we serve. It will require practicing in surface-level care rather than having the ability to make a meaningful impact on our patients' health outcomes.
I chose to work in a community health center, but am now being asked to practice corporate medicine in a nonprofit organization, focusing on quantity over quality. How will I tell my patients that they're only worth half my time?
I asked the El Rio Board of Directors to please join us, the AFSCME union employees, in brokering a fair labor management agreement for all El Rio employees.